Bird's eye view regarding Ayurved. I am very happy to take you to the world of Ayurved. In this modern era of globalization, Ayurved is being given a serious attention in the form of an alternative medicine. So it is time to know about Ayurved initially and then study it in a deeper way. Before actually entering the field of Ayurveda, it would be better to have a bird's eye view of the medical systems in general. It is a natural instinct that a person desires to live long, healthy, joyful life. As far as these things keep on going smoothly, one generally doesn't bother. When there happens to be a problem regarding health, the person wishes to get rid of it at the earliest, with minimum expenses and preferably without any restrictions. There is nothing wrong in this thought, but on a practical level, it may take a totally different turn. Let me try to explain how it happens. First of all, let us understand the difference between a treatment and drug or medicine. People have various notions about medical systems as per their knowledge and experience, and they spread their opinion quite freely. In India, there are so many medical systems which are in practice. The modern medicine is widely spread and receives first preference in most states of India. But in spite of this situation, there are a few practitioners of Ayurveda, homeopathy, naturopathy, Unani, and biochemic, etc. People try to differentiate these paths according to the use of type of medicines or even by the mode of treatment. For example, the injection route of medicine is known as modern medicine. Even educated, learned persons from urban areas believe that injection gives immediate relief. So the doctor who gives injections is really a good doctor. What to speak of illiterate and village-based people? Now, with the rapid spread of AIDS, the use of injection is becoming less and people are turning more to capsules and tablets, etc. On the other hand, people understand homeopathy in the form of small sugar pills. So one who gives such pills is a homeopathic doctor. People understand Ayurveda in the form of medicines such as herbs, decoctions, pills, matras, a special kind of medical preparation which is instantly effective by rubbing it in a medium like honey, etc. Medicated oils, asava, a kind of medicine with self-generated alcohol, etc. So any person who gives such medicine is known as Ayurvedic doctor. A naturopath may be known as a person who emphasizes on fasting. These are general beliefs. I once again explain they may vary from person to person according to their knowledge and experience. But then this belief does create a problem. A fact should be well known that every medical system has its own theory about health, illness, and solutions to these illnesses. Diagnosis of a disease is a part of this theory and medicine is a part of its treatment. But people understand medicine as a treatment and hence may keep on asking whether you know some medicine for this particular disease, etc. In this case, the whole credit goes to the medicine and the results are also quoted as drug results. So the people, even from the medical system, try to emphasize drug-oriented research. In this situation, it would be worth to look back again to know treatment. Treatment, as explained earlier, is the outcome of the theory about the disease. That is, according to modern medicine, as aspirin has analgesic, antipyretic properties, it becomes a drug in fever. Due to anticoagulant property, it becomes a drug in heart diseases. Since fever is due to infection, according to modern medicine, use of antibiotic is the treatment. Proper antibiotic may be chosen as a medicine according to the modern medicine. Ayurved, on the other hand, thinks quite in different way. Since the digestion is not proper in most of the cases of fever, fasting is a treatment for fever according to Ayurved. Medicine with a bitter taste is a drug for fever according to Ayurved. One may try to understand that getting a disease or becoming ill is a complex phenomenon involving many factors, and achieving health again is also dependent on so many factors. Every medical system has its own views about this, and treatment and drug are a part and parcel of the systems. So, drug or medicine should not be considered as treatment, especially in cancer. Destruction of abnormal cells is the principle of treatment in modern medicine, and chemotherapy is a drug and not really a treatment. Ayurveda has a different principle of treatment of cancer and hence is useful even in advanced stages of cancer with different forms of medicine. After having a bird's eye view regarding various medical systems, one would really understand that it is necessary to know the basic principles, the concept of the disease and health, the treatment, etc., for the knowledge of any medical system. A person keeps on acquiring knowledge throughout his life. Each time the knowledge is assessed on the basis of previous knowledge without even knowing about it. This gives rise to another kind of thinking on personal basis, receiving the same knowledge. For example, different personalities reading my book from various fields would naturally be acquiring knowledge with different background. Some may be medical practitioners of another system who would try to compare the knowledge with their system. Some may belong to various non-medical fields and may be interested in reading this book with different intentions. For example, one is suffering from a disease and wants to know whether Ayurved can help him/her in this regard, whereas another healthy person may just be interested in keeping health according to Ayurved. Another person may be interested just for knowledge purpose and so on. But it is worthwhile to note that the perception of knowledge changes according to the background and purpose. This is dependent on particular mindset and even can lead to a particular mindset. I want to make a humble request that please try to understand Ayurved with a clear slate without any preconditioned knowledge. First, try to understand what Ayurved is, what are its basic principles, how it is useful in maintenance of health or curing the disease. Later on, you may make a comparison with other medical systems. With this background, let us now enter the field of Ayurveda.